Welcome back. My name is Matt Lee, and I'm with Kentucky Orthopedic Rehab Team here in our beautiful Shinaway Clinic. And today, our topic is going to be how to find and discover your specialization. And this starts off when you're a new grad or a young clinician, and people ask you, what are you going to do? And you think, I'm going to work in sports, or I'm going to work in ortho, or I'm going to work in neuro. And the next question people ask you is, well, great, you're going to work in sports. Who do you want to work with? Do you want to work with football players or hockey players? Do you want to see post-op shoulders or rotator cuff repairs? And if you say ortho, do you want to work with workers' comp? Do you want to see low back pain or chronic low back pain? And when people ask you those questions as a young clinician, there's some pressure to answer. And there's some pressure to kind of figure it out right there. But the issue is you don't know, and you don't know what you don't know. So the goal of today is to talk about how to discover your specialization. And I want to give you 2 steps that hopefully will help you to determine how to figure this out. So the first step is 1, be a generalist. It's okay to be a generalist. In fact, David Epstein has a book he just wrote called Range. And David Epstein argues that being a generalist is actually better for creativity, for innovation, for efficiency, and it helps you to see things across the spectrum of the working world. In physical therapy, when you start off as a generalist, you can understand movement throughout different settings. You can understand movement dysfunction, weakness, you can understand physical impairments, and it doesn't matter which setting you work in because you're going to figure those out in each setting, but having a broad base as a generalist is really going to be helpful. So a few tips in terms of being a generalist. For your first job, whatever it is, my advice is to be good at it. Commit yourself to it. And you'll discover along the way, do I like this? Do I not? Do I need to change gears? Am I happy here? But if you go into your job and you don't give it your all, you're not going to fully discover that. So 1, be really good at your first job. Second thing is talk to people. Network. This is a really important part of life that people in PT school, we don't really talk about that much, but talk to people in neuro settings, talk to people in home health settings, talk to people in the sports world, and furthermore, talk to people in these different niches of their industries. Talk to people who sees just workers' comp, for example, or talk to people who are educators and find out what they do and just get to know them, because that's going to be a really good way for you to open your mind to start saying, I'm a generalist now and I'm doing everything pretty well, but I don't know what I want to do. The second piece of advice after talking to people is go to professional meetings. Go to CSM. CSM is one of the best meetings you can go to because all the sections meet together. And when you go, whether it's online or physically, go to sessions you normally wouldn't. Go to the federal section. Do a meeting in the women's section. Do a meeting in the acute care setting. Do a meeting in ortho. And a lot of times young clinicians go and they just pigeonhole themselves into things, I think I like this. But really, your value on going to a meeting like that is seeing the whole spectrum of the profession and discovering what topics are out there and what energy people are bringing and excitement they're bringing to their fields. The other one you want to do is read. And people think, I just finished PT school, I don't want to read anymore. But reading is a really nice way to figure this out. It doesn't really matter at this point if you read blogs, if you listen to podcasts, if you read journal articles. But make sure you're getting a smattering across the board of what's out there. In terms of the second step with discovering your specialization, the word I'm going to talk about is energy. And in life, you only have a certain amount of energy to expend, and there's other things that give you energy. And when you're talking about energy and specialization, you want to find things that give you energy. You want to find things that invigorate you, that make you more interested, that bring you more joy in terms of your day. And you don't want to do things, on the other hand, that you finish your work day and you think, oh, that was a long day. You want to finish things and say, that was a challenging patient, exciting experience, that was really good. And the reason why is because specialization, whatever it may be, takes a lot of hours and a lot of time and a lot of work. And if you go into a specialized area and it's stealing energy from you, you won't have anything to give to your friends or your family or your rest of your life. So find an area that is going to provide you that energy back and that you'll be happy to dedicate time to. A few tips on this is that when you're a generalist, take a step back and take an honest assessment of the things that you're doing. So for example, and I'll say, look for black holes. And what I mean is black holes are events or activities you do that suck your time. Look for things that you say, I can't believe I just read 2 hours on that topic. I can't believe I just spent an hour talking to this person about, an ACL reconstruction or whatever it may be. When you're talking to people across the field, find those areas where you think, I just can't get enough. Find the areas where you think, that just sucked my time. When you're reading articles, when you're reading blogs, find the topics where you think, I just lost 2 hours and it just went by so quickly. Once you've discovered through talking to people, through being a good generalist, through really being honest with yourself, what the specialization, what you're willing to find your time black hole with, then you can start to get an idea of what your specialist is going to be. The hard part about this is being very honest with yourself, because you may find that your interest is veering from what you thought it would be. You maybe graduated PT school and thought, I want to do PET. But then after talking to people and after reading, you may think, you know what, I'm really invigorated by administration, and I never thought I would be an administrator. Or you think, I'm really invigorated by neuro, and I had no idea that that was my interest. I didn't think that's what it was. So this process is really helpful, just to be very honest with yourself in terms of discovering what is your true black hole. So in terms of finding your specialization, the 2 steps. 1, be a generalist, and it's great to be a generalist. You will learn so much. Number 2, discover your black hole, discover your interest, discover what you're putting time into. And 3, go for it and excel.